back to Sunrise today. Yes, indeed. Now we're joined by Professor Ali Pate, who is the Coordinating Minister of Health and Social Welfare. Good to see you again, Prof. Thank you for coming out today.
Good to see you. Thank you.
Well, I know we touched a little bit on this health insurance the last time, but yesterday there was a significant event that occurred, so which is largely what we're going to focus on today. So just go ahead and tell us about this launch of the National Health Insurance Authority.
So we discussed in the past, financing of health is key to improving the health of Nigerians, to achieving universal health coverage. The National Health Insurance Authority is an important institution that will drive Nigeria's move towards that. Yesterday, we launched its operational guidelines for 2023 and going forward. That was a product of several weeks and months of consultation across different actors that tries to clarify the roles of various stakeholders in the promotion, in the regulation, and the integration of health insurance in Nigeria, across levels of government and with other actors in the space, so that we implement the mandatory health insurance that is provided by the NHIA law, which was signed in 2022. And that's an important part, and that clarifies the roles and responsibilities of actors and the processes through which we can expand access to health insurance to achieve universal health coverage and to provide financial protection for our population. Of 8.4% of Nigerians, less than 10% are covered by any health insurance. This administration is focused to expanding health insurance, improving financial protection, as well as achieving universal coverage as a longer-term objective for us to save lives, to reduce pain, both physical and financial pain of Nigerians, as well as produce health.
You know, the last time we tried to identify that health insurance scheme, some of the key issues that happened, why that failed, because getting that right was very key to ensuring affordability and access to healthcare in the country. And several people went ahead and listed some of the challenges they saw with the NHIS, why it didn't work. And there was a long list: poor implementation of the Act, poor government funding of healthcare and health insurance scheme, optional enrollment policy, inappropriate practices by the regulatory agency, health maintenance organizations, and the providers, and lack of political will. They also added that part. So now that this has been launched, these guidelines, which you spoke a lot about yesterday, what makes you really optimistic that this time things will be different?
Nigeria's journey on health insurance has been a very long one, a tortuous one. It's more than 40 years in the making. But we're at a point where we have, by law, in 2022, the new National Health Insurance Authority and National Health Insurance Authority Act basically has made it mandatory. That is one of the deficiencies of the previous legal framework that we had around this idea. We've got a very strong institution and a collection of partners, not only at the federal level, but also with the states keying in through their state health insurance authorities and the other actors in the private sector to come around this agenda and execute to expand the coverage, the risk pool, basically, so that more Nigerians will be covered. So I think the journey that we have had has come to a critical turning moment, and we should expect a more faster expansion of health insurance in Nigeria once we implement in the direction that this operational guidelines has now provided for us to do.
You know, I also found that, in fact, from several literature out there, that the out-of-pocket expenditure as part of our total health expenditure, they say it was about 64%. Do you have any projections in terms of, now that this NHIA is in place, any projection in terms of how soon, what can reduce and when, things like that?
Nigeria, we have much higher proportion of out-of-pocket spending in our population than many other countries in the region or even globally. We have among the highest. And that's a problem. And that's what we're trying to change now, driving in this direction through the NHIA. But it requires states to work along with us in terms of having the right capabilities in their state health insurance schemes, paying their counterpart funding to the federal government in terms of funding that has been made available for the Vulnerable Groups Fund, but also in terms of really standing up and enrolling their own employees in the formal sector side. But there are several other actors also in the private sector that will need to play their role in terms of complementing what the government is doing to move this forward. So, yes, it's been a long journey. I would not venture to tell you that we'll get to 30% overnight, but we will make steady progress in expanding the coverage with health insurance on our path to universal health coverage. Mr. President has made promises that, in fact, millions of Nigerians will be covered, and we already have a provision, at least for the vulnerable groups, which we need to expand. It's not enough what is being put through the Basic Healthcare Provision Fund, and we hope that private sector philanthropists would contribute, in fact, to that fund so that we take care of all vulnerable Nigerians, ensure they have access to affordable and quality health care.
Yeah, because, I mean, they need to be protected from financial hardships of these huge medical bills that are there. But I know my colleagues got questions on states, but before then, now, part of the challenge, too, for the NHIS, we look at this current guideline soon, is that they function as both the regulator and operator. That was in contravention of the Act, stipulating that they should function as a regulator with defined roles. But this NHIA now is going to be a little different, isn't it?
Yes, the NHIA is a promoter, it's a regulator of this sector. It gives it more teeth and, in fact, provides a role for different actors, including the state social health insurance authorities, which ought to be created and stood up by the state government, and also provided a distinct role for the HMOs, which are an important part of the ecosystem, in which case they can be involved in terms of supplementary insurance, or they can be third-party administrators for where there are deficits. So there's a clarity and role between what the NHIA would do and what the private sector would do and what states will do. It's all of those collectively and the fact that it's mandatory that will expand and will advance our progress in terms of getting to universal health coverage to achieve the Sustainable Development Goals, improve financial protection, and ensure access, quality healthcare services for Nigeria. For the basic side, that is something that every Nigerian should be guaranteed access to the most basic healthcare.
This NHIA, it makes it mandatory for us to be on that scheme. So just like tax, the people have to be on this. So how are we going to ensure that this NHIA, I mean, they're going to implement it and then at the same time guarantee people's fundamental rights?
I think it's sort of embedded. Health is a human right as well. The access to health is a right for every Nigerian, and we should strive to get that. Now, the operational guideline is the first step. There's work that is undergoing in terms of implementing the mandatory aspect of this, and that will be coming out very soon, in addition to finding ways through innovative financing to expand the pool of funds. I'd mentioned previously that Nigeria has not been spending enough on its health, and we need to do more. We need to do more in terms of domestic financing at the federal level. We need to do more at the state level. And in fact, individuals can contribute more to their own health. And it is that collation of efforts that will improve the resource that is available to finance care for those, for all of us, in fact, including the most vulnerable among us, so that we don't leave people behind in terms of access to health.
All right, let me bring Ayo in on this matter before we get to other issues. Go ahead, Ayo.
Thank you, Chamberlain. Well, once again, one has to commend your efforts in getting these things done. And one of the questions that I was going to ask you, Chamberlain, already took you up on it, which is, the fact that it is mandatory for every Nigerian to be on it. Well, the angle to that question for me is how this law and the authority will factor in small and medium enterprises, those who cannot even afford to get on the program. What's the plan for them? Perhaps by exploring that, responding to that, you want to speak to us exactly what the operational guidelines for the NHIA actually is. What are we to expect? What are Nigerians to expect? What are the things to do, when, where, and how?
The operational guideline is really the steps that are being taken to translate the law that was passed and signed 2022 in concrete way, clarifying the roles and responsibilities of various actors and the process through which we can ensure that the mandatory nature of health insurance that has been passed into law is actually manifested. Providing the roles for the federal government, what it does through the NHIA, but also states in terms of their role in the context of health insurance in Nigeria, as well as the private sector. So over the period that will be ahead, I think we would see states standing up more of the state health insurance authorities. We can see the supplementary insurance that is going to expand through private sector, also through funding for the vulnerable groups, of which already is provision through the Basic Healthcare Provision Act, which is 1% of federation account that is allocated to primary healthcare, about half of which goes to the Vulnerable Groups Fund. A small amount, relatively, but it's expected that others will join in that pool so that we cover more of the poorest and vulnerable Nigerians to have access to insurance. The traders in the markets, the farmers, the teachers, others that may not be able to, who are in the informal sector, who are poor and vulnerable, should be covered. And that requires a concerted effort across different sectors to make that happen. That is what this operational guideline is trying to do, to provide a roadmap and practically how this is going to happen across our country to expand health insurance in the period ahead.
Essentially, then, the question of how exactly, or rather, maybe I should be asking, what do people need to do? You know, of course, that we have quite a number of people in the country who barely eke a living a day. You're also not unaware that there are a good number of people who are unemployed, sizable number of people in rural areas in Nigeria, and you've spoken to the Vulnerable Groups Fund. So how do they access this service, which you say is already being provided for through the Vulnerable Groups Fund?
So the first step would be for all states to ensure that their employees are actually enrolled and they pay their premiums as well, and that they pay their counterpart for the BHCPF provided funds. That is one practical step that state governments can do, and that will improve the affordability, the coverage of the population in their respective states. In terms of the Vulnerable Groups Fund, we already have some funding available, and we expect that there will be other additional resources that are more strategically placed to complement what is being put by the government. For instance, external partners, private sector philanthropists can join that Vulnerable Groups Fund to provide coverage for those who are most vulnerable in our population. I think we have a long way to go, but that road has to be started, and I think that's what we're trying to do. From less than 10% of Nigerians being covered by the health insurance program, after several decades of effort, to see concerted increase in terms of coverage of Nigerians in the health insurance program.
Honorable Minister, you nailed it yesterday in your presentation when you mentioned the fact that we've been at this for 40 years and only 10% of Nigerians have been covered. That is indeed concerning. A good number of people will reference it to the diminished trust between government and the governed. Already people have that issue with the federal government, and now states have to domesticate this in their own, in the individual states. We understand that this governor of Lagos State already issued a directive in that regard. How do we shore up that trust deficit so that people can buy into this? Because, you know, most of the time when we mention government, people are a little edgy and iffy.
Yes. So I think this is an important point, and I think the renewed hope agenda of Mr. President is precisely that, resetting the compact and delivering on those promises that we have laid out. And that requires us working to earn the trust of the population by providing the resources so that our people being covered through the Vulnerable Groups Fund is the formal enrollment in the health insurance program available. At the federal government, there is no issue. All federal employees are formally employed. Now, if states do that, and other employers in the private sector also complying, and that's the work that we all have to do to manifest this aspiration that has been laid out. At the end of the day, is a Nigerian population that has to build consensus that, in fact, moving towards universal health coverage is important. We are, with the leadership of the president, providing that direction and providing an institutional backup through the NHIA and a framework through which states, private sector, and others can join in that. And I call on all Nigerians to actually support this direction so that we begin to take into account the entirety of our population and the health of our population as a priority and not leave anyone behind in terms of access to basic healthcare service. Universal health coverage is a right. I think there should be no person trading off between whether to pay for food for their families or to pay for treatment of malaria, for instance. And there are many Nigerians who are being pushed into poverty because of catastrophic health expenditure. When something like cancer hits a family or kidney disease, some folks have to sell their assets to be able to afford that, or the cost of pharmaceuticals. And that is what we're trying to do, set the direction and provide an institutional framework. And federal government is putting forth the money, but that has to be complemented. It's not going to be enough by itself, and others have to join in that movement. So it's all of us together moving in one direction that will achieve what has been difficult to achieve for more than 40 decades in Nigeria.
When you talk about the cost of pharmaceuticals, it is concerning. I remember having a conversation with the DG of NAFDAC. He spoke to the fact that we are in some kind of jeopardy. She spoke to the fact that we're in some kind of jeopardy because a good number of the things that are being used to produce drugs in Nigeria are imported. That puts us at one risk or the other. So it also speaks to the cost of medications that come into the country and that people can get across the counter or prescribed. But let's take that on when we return from this break, Your Excellency. Please stay with us. Thank you for staying with us. The Honorable Minister, Coordinating Minister of Health and Social Welfare is with us this morning, Professor Ali Pate, in our Abuja studio. Well, you know, we're talking about the cost of medications, you know, that people have to contend with. Chamberlain was speaking to about 64% of Nigerians having to pull resources out of pocket in the past. How do we address this in a way that will be Nigeria will be safe and insulated from the vagaries of, you know, rising cost of medications? Someone was sharing that a particular drug that was probably being sold for, you know, maybe less than 10,000 is now going for something in the region of 26,000 naira. And so, help us speak to that in the light of this new arrangement of the NHIA, that's the National Health Insurance Authority, and how that the authority and the initiative of the insurance scheme will help to ameliorate these costs.
In the context of the 4-point agenda that I had laid out a few weeks ago, for instance, the improvement of governance, this act and its operationalization is key to it. Improving population health, service delivery and financing is key to it. That's what the health insurance expansion would do. And the medical industrialization is trying to build an ecosystem so that our private sector is able to produce locally quality pharmaceuticals that would be affordable to our population since we don't have to import them, and also ensuring that we have health security, and that includes domestically manufacturing the commodities that we need. Recently, as part of this act, NHIA initiated the medical supply partnership with 12 pharmaceutical companies who will produce branded medicines, a list of very critical medicines, branded with the NHIA logo, in partnership with the pharmaceutical industry to guarantee not only the cost, but also the quality of those pharmaceuticals. And that will go a long way in reducing the overall proportion of the spend on pharmaceutical as part of the delivery of healthcare, but also potentially lowering the cost even for those who may not yet be insured, because the proportion of pharmaceutical expenditure out of pocket that we had mentioned is actually significant. So by lowering the cost of pharmaceuticals, at the same time guaranteeing the quality, we would be addressing that. And I think in the next 1 to 2 days, you will see the NHIA Director General and the Director General of NAFDAC working together and addressing Nigerians in terms of the way we are working in the health sector to improve the affordability while at the same time guaranteeing quality. You don't want to have affordable drugs, but they are of poor quality. You want to address both the affordability while at the same time guaranteeing quality. And the medical industrialization, our domestic pharma industry, will need to be revived in a way that it produces much of what we need. At the moment, 70% at least for pharmaceuticals, of generic pharmaceuticals are imported for us from countries that we don't have full control. And so trying to deal with that, as well as dealing with the supply chain within our country to ensure that, in fact, we can guarantee that counterfeit and substandard medicines will not get into that space, because that will harm Nigerians as well, in addition to the harm to their own pockets.
Is there a timeline within which states must domesticate this law in the states?
I think it's overdue. The overall effort, I think, is overdue. So we expect and we will urge all states to domesticate this law as soon as possible. There is work that is underway and will come out with it in terms of the mandatory aspect that has been the central feature of this new law, which has created and changed the nomenclature from National Health Insurance Scheme to National Health Insurance Authority, and that expects states to actually have their own state health insurance authorities, which have more teeth, and states need to domesticate it really as soon as possible. I think it's overdue. There are many Nigerians suffering from the cost of ill health, not only in terms of their productivity, but also in terms of the cost of taking care of their loved ones and themselves. And we need to address that. And that's going back to the idea that you alluded to, that Nigeria health can be a basis for reunification, but also re-establishing that compact between the population and the state. And state government should complement what the federal government is doing through NHIA and through the Basic Healthcare Provision Fund to ensure that all Nigerians have access to basic healthcare on our path to universal health coverage, and that the most vulnerable populations are also covered. At the moment, roughly 1.7 million vulnerable Nigerians are covered through the Vulnerable Groups Fund. But we intend to expand that, and we hope that we would get the resources to expand it. Not only what government is able to put in, but also what other actors, our private sector, our philanthropists, will expand. We should be our brother's keeper when it comes to health. It should not be a poor person somewhere who would have his or her child die from a vaccine-preventable disease because they have not been able to, the health system is not able to provide it for them, or someone who needs the care that is critical. Vaccines are free, for instance, but there are other conditions that require people to pay for pharmaceuticals, for instance, pay for medical tests, to ensure that those do not become barriers to access to quality healthcare.
This leads me, Prof, this leads me to this next question of whether or not there are certain conditions, health conditions that are covered or not. Once I had a conversation with a medical practitioner, a physician in a private hospital, and he said that he would not take, their hospital wouldn't take certain recommendations from certain institutions, particularly of state, for the reason that for the reason of what the states will pay them as a result of their intervention in the health insurance scheme in that particular state. So are there conditions? For instance, another concerning figure that came from us yesterday on this program is that we have very low intervention in the area of mental health. The medical practitioner who spoke with us, a psychiatrist, said about maybe like 1/3, like 60 million Nigerians are dealing with one kind of mental illness or the other. We've also seen statistics, I'm sure you're aware of it, that says that about 70% of the population or so are dealing with hypertension. So I'm just wondering if there are other cases. You mentioned cancer the other time. Are there certain cases that are not covered under this scheme?
Well, there's a basic healthcare package which has been defined, has been costed, and that includes the most common ailments that we have, whether they're maternal, whether they are non-communicable diseases like hypertension, diabetes, even aspects of cancer care, sickle cell disease, mental health. Those are all included in that basic healthcare package. There are others that you might say they are more private good. So for instance, plastic surgery. Why should there be public resources geared towards financing someone's choice to do plastic surgery, for instance? And there are others that may be much more expensive because this is an insurance pool that would need more strategic interventions. So in terms of cancer care, for instance, there's a cancer care fund, and there's also an intervention around dialysis. So dialysis for kidney disease is covered up to certain sessions, and then there is an effort put by the federal government to intervene in terms of the kidney disease for others strategically. Those efforts are on the way. But at the end of the day, I keep going back to this point that to improve the health of Nigerians, all levels of government needs to step up. What the federal government is doing is investing, has robust institutions, and has put quite a bit of effort in setting the direction, providing the framework, mobilizing its own resources, but also external resources. What we need is states to equally prioritize health, strengthen their own institutions so that all the population that we have, the disparities that we see are minimized and that we cover our population as the Nigerian state.
You know, so part of those, I mean, the poor government funding of healthcare and health insurance scheme were part of the factors that was identified as to why the NHIA didn't achieve as much as it was desired to. Hence this NHIA and its operational guidelines. But then there's this basic healthcare provision fund as well. So the funding component is crucial. I see a long list of guidelines here, several pages of these guidelines. So talk to us about this, because I know you were instrumental to this coming on stream. So what do we expect with this guideline?
So you mentioned the basic healthcare provision fund, which is really an outcome of the health reform that has taken place over many years, and has put 1% of the federation account aside into that fund to advance primary healthcare in Nigeria. 45% of it is on the supply side, which is the Primary Healthcare Development Agency, which is more on the input side, the human resources and all. The other part, 47%, is on the NHIA side, more on the demand side, on the affordability side. And that is channeled towards the Vulnerable Groups Fund. It's not the entirety of the Vulnerable Groups Fund, but it's a contribution towards that. Expectation being that private sector, philanthropists and others will join in that to cover increasingly higher numbers of the poorest and vulnerable populations in our country so that they have health insurance. And there are hundreds of thousands of our population in rural areas right now who have access to health, who have health insurance. They can get the care that they need at no cost because it's covered under this scheme. And we need to expand that. And that expansion will be a gradual process. We are in the process of operationalizing the BHCPF. We're going to make it the anchor for driving the renewed health, the renewed hope agenda in health as directed by the president. As I mentioned, the president really is keen that we transform, we break through in the Nigerian health system, deliver better for all Nigerians, and that we do it in partnership and in coordination with states, as well as with private sector and other actors. So that's the anchor that we would use. The element that is related to health insurance scheme, the Health Insurance Authority and the guidelines that you mentioned is on the demand side, on the affordability side. It also touches on the supply initiative, which is linked to the industrialization that we're also going to be working on going forward.
So the HMOs, providers and enrollees were exposed to some sort of risk with the last scheme, the NHIA. So I just had some list of some of the concerns that quite a number of them raised while we just went around sampling opinion. And they said, a situation where a provider receives the same premium for a 75-year-old and the 15-year-old never provided or promote efficient service delivery. What do we expect this time?
I think first of all, with the law and the operational guidelines, the role and responsibility of different actors is clarified. HMOs have the opportunities to drive supplemental insurance, be involved in private health insurance, as well as third-party administrators. And states have their role in terms of their health insurance authorities and, of course, the National Health Insurance Authority as the regulator. And the pool that has to be created has to be large enough. At the end of the day, it's the aggregation of this, you might call micro pools, into one large pool that will guarantee universal health coverage for all Nigerians. So the space is an ecosystem. And the HMOs are an important part of that ecosystem, but the roles and responsibilities have never been as delineated as they have now been with this new act and the operational guidelines that we launched yesterday.
So does it mean that a provider with 5 enrollees and perhaps one with 1,000 enrollees cannot receive the same rate of payment anymore?
I think in terms of the individuals covered, yes.
Okay, so maybe I should slow down this act and go to other issues that are bothering Nigerians on this matter. You know,
can I just add one thing? I think back to the question of exclusion. Recently, there's been concern about patients who show up at the emergency facilities and police reports being asked whether gunshot wounds or accidents. That's really unfortunate, but for all federal teaching hospitals, for instance, I was in Maiduguri over the weekend, lives have to be saved. That's first. And we've re-emphasized that. All our hospitals, and I believe that they are doing that no person should come with an emergency, life-threatening challenge and be made to lose their lives while awaiting for police report. Lives should be saved. Saving lives comes first. I just want to make that point. And that's the direction that we have given, and that's what we would pursue. And we hope that all hospitals, including private hospitals, will have this mindset that in health, we save lives first.
So in other words, there has to be an enforcement mechanism by your ministry. Would there be, I mean, your ministry should be accessible. If people have complaints that these health facilities are still flouting this directive.
Yes. All federal hospitals that are directly under our purview, and we'll also work with the states to ensure that all hospitals, because the regulation of health is an area where there's also that similar fragmentation between federal government and states. States regulate the hospitals under their purview. So in states regulated hospitals, we expect that direction of the federal government will be an example that they also follow. But it's not only the public facilities, there are also private facilities. Yeah. As health professionals, saving lives comes first.
Yeah, that should be the key. So we're hoping that both state commissioners of health and several other agencies in those states should ensure that these things are enforced. You did mention how we import a lot of drugs from countries we have no control over, nothing whatsoever. So drugs, they all come into this country and it causes a huge challenge. And I know that there's been several attempts, for instance, in the area of vaccines, to ensure we have some sort of, at least a leverage, a foothold in the country here. Could you talk to us about, one, the vaccines, and what are we doing to ensure we have basic components of some key medicines and drugs in this country manufactured here?
I think Nigeria is late in the game of this in terms of the pharmaceuticals, but also the biologicals like vaccines. Many years ago, we used to produce yellow fever vaccine at Yaba, but we left that to fall apart. But within the context of what Mr. President wants us to do as part of his renewed hope agenda, this idea of unlocking the healthcare value chain and medical industrialization is an important pillar of that, to reverse it. And that requires policy interventions, it requires regulatory interventions, and it requires financing and investments. So what NAFDAC has been doing, now it's reached maturity level 3 as a regulator. It needs to go up to level 4 over time. That means the ability to regulate what comes into our country and how those things are being distributed. That will help our domestic industry as well to have the muscle strength, basically, to produce quality products. Because the fact that we want to produce locally doesn't mean we should produce lower quality. We should produce the highest quality that we can produce, but within the country. Now, there are other aspects that are needed in terms of the active pharmaceutical ingredients, the excipients, some of which we'll have to harness them locally, and some of which we'll still have to import them. But let them be imported and be streamlined in how they come into the country. There's the overall business environment, the ease of business environment, which goes beyond health, which requires other aspects of government, whether it's customs, whether it's trade and investment, working together. And I believe that Mr. President is working towards getting all of those actors to work in tandem as one government to improve the enabling environment. And then the demand, the market shaping. What NHIA has done through the Medical Supply Initiative is one example of shaping the market so that there is better access in terms of affordability, but also better quality of those products. And then investors. In just the last few weeks, since we've been in office, there have been several outreaches to us by individuals who are interested, who are local, but also external investors to come in because we have a large market. We are 220 million Nigerians. We have the market pool that folks who want to invest and produce here. In vaccine technology, for instance, the new technology of mRNA vaccines, we have had conversations, in fact, with a few other African countries that we would, for instance, on Lassa fever, begin to position ourselves when a vaccine becomes available in the period ahead, maybe in the next 1-2 years. There may be a vaccine against Lassa fever. It may be the mRNA vaccine might be just like Moderna or Pfizer vaccine. Lassa is here in Nigeria, the town in Borno State. So how can we position that, in fact, Nigeria is an actor that will serve us for today, but will also serve us in the case of another outbreak or pandemic in the future, that we have some manufacturing capacity in our country. There's a BVNL effort that has been going on for many years. We look into it closely to see whether there are structural limits, whether it's sort of the way it's financed, or the technological challenges that will need to be resolved. But at the end of the day, we need to have a portfolio of actors that are contributing in this medical industrialization agenda, and with the regulatory framework in place to guarantee safety, efficacy, but also the financing framework that allows it, including from the private sector, to happen.
Good place to anchor, Professor Muhammad Ali Pate, Coordinating Minister of Health and Social Welfare. Thank you for coming on, and well done for the work you're doing.
Thank you very much, sir.
All right, let's take a comment or two. We have some who are watching. This is from Professor Imonoha, who says the economic development and prosperity of Kogi State must evolve through and from the local to state economy in building a viable and sustainable development economy whose principles and policies are interdependent in building an entrepreneurial economy that is indigenous. This will unleash the power of true conceptualization of an industrial and innovating economy in transforming a communal, emerging economic integration and a prosperous state. We also do have this one from about the health, which we just spoke about. Taiwo Olokbade says, aside insecurity and lack of food, another major challenge confronting Nigerians is lack of quality health care delivery. It's really amazing that since 24 years of unbroken democratic rule, Nigeria still doesn't have functional primary health care facilities in up to 70% of the 774 local governments nationwide. If this is one of the achievements of Tinubu administration, Nigerians will show appreciation for it.
Professor Sakinboyewa has this one. The level of violence we are seeing in Kogi is alarming. However, Kogi voters should come out en masse to vote. Traditional leaders, CSO, security agencies, and election monitoring groups must play their critical role of promoting peace, protecting the integrity of the Kogi governorship election, and ensure it is violence-free. Musa Mohammed, speaking in the same vein, says it's so amazing that politicians have solutions to problems before they are elected into office, and when they get into office, those solutions are not practically achievable in the real world. They start to blame previous government. We have a lot to do as citizens.
Yeah, we sure do. So there you go. That is the show today. We'll see you again tomorrow. Thank you for watching. I am Chamberlain. So
have a beautiful and productive day. I'm Ayo Makinde.